healthcare workers, mental health care workers on the participants list. So feel free to put your questions in the chat box or raise your hand at the end of the session. So Dr. Kumar, karibu.
Thank you very much. And thank you, Dr. Kinutia and my colleagues from KNH for inviting me. I'm not a psychiatrist, although I work in the Department of Psychiatry. I'm a clinical psychologist, but nevertheless, I think I'm able to adequately address and complement some of the things that I know that Dr. Kanana and others will talk about. Shall I share my slides?
Yes, please.
Okay, let me do.
Thank you. Sorry for...
Don't worry. Can everybody hear me all right?
Yes, we can hear you. Dr. Before you start, kindly let's unmute our microphones.
Okay, yes.
And if possible, also our video so that we can concentrate on the presentation. Asante.
Okay.
Thank you.
Okay, I'm sharing my slides now. So I need a few minutes of your time, so it won't be too long. The title is Understanding and Reflecting on Self-Care During COVID-19. This is an emerging situation, so it requires all of us to think through these issues. The solutions need to be creatively arrived at. And some of the questions that I think this presentation should flag off for you are, what does self-care mean to you? Do you take care of yourself? Rather, that should be the first question, that are we used to taking care of ourselves? What does it mean to us? What spheres of health do we know of? What kind of strategies can we think of in relation to helping ourselves? And how do we take care of ourselves at work, at home? And do we have similar approach of building proactive, healthy relationships? And then what sort of self-care practice can we add to our routine, given that we are all in a highly abnormal situation of physical as well as social distancing, yet we have to be connected to others and look after ourselves. So one of the things that I have taken to heart is this idea that patient care starts by provider self-care, which is something that I know you will all understand. But in a nutshell, what it means is that where healthcare providers are careful about their own mental health, about their own well-being, they can attend to the patients better. And sometimes our systems don't allow that kind of time and space and resources. And in this situation, it is particularly important to be mindful of one's own health and mental health in particular. So this wheel of self-care is not new to you. All of you are very knowledgeable in how nutrition, exercise, some mastery of stress, some understanding of what healthy relationships are, the value of organizing our finances, planning, prioritizing work, our career development, prioritizing play, which could be creative, imaginative play, it could be exercise, it could be other hobbies, so playfulness, so to speak, healthcare, environmental factors. It's also very important to have purpose in our life. We feel much more satisfied when we are driven by some purpose. Self-esteem is very important. If we undervalue our own selves, then it's very likely that the world would appear very wonky because we ourselves undervalue ourselves. Spirituality is also a very important component, and we know that people who have belief in a higher power, on some spiritual sort of practices, will do much better in life than many others who do not hold any value systems or beliefs as such. So what is self-care? WHO long time back defined it as what people do for themselves to establish and maintain health and to prevent and deal with illness. And it, in a nutshell, encompasses hygiene. And this is particularly important in today's environment, where hand washing and specific kind of hand washing and kind of staying away from one's contact with face is concerned. Nutrition, that it's now that we are at home, are we having, adequate, but also mindful of what we are taking in. Lifestyle, what sort of, are we engaging in some sort of exercise? Are we taking time off to rejuvenate ourselves? Our environment.
Mwache Safina, we maliza, alafu Samifina atabaki hapa, wewe uende na dadini. Okay?
And socioeconomic factors may not be in our control, and may need a little bit of, they may be beyond our reach. But I think at this particular context, we have to optimize and make sure that whatever our living conditions and habits are, we are falling in line with the recommendations, but they are an important part of self-care. All of these things are linked, and hence, in some ways, a failure to take care of one aspect does affect other aspects of not only health, but more importantly, mental health. And therefore, we need to listen to our bodies, we need to listen to what our emotions say, and heart, I guess, refers to emotions, and what our mind also tells us, and take feedback from others to attain resilience, well-being, or a balance.
Excuse me, Dr. Kumar.
Yes,
Hello.
please.
There's some background noise and you're not coming out so clear, but your slides are showing very well. So
is it better now?
Yeah. Yes.
Okay.
Maybe we can try and. But there's some background noise. Thank you.
At my end, there is no. I'm not hearing any noise, but let me speak closer to the mic if that helps. So this is in a nutshell of what this conceptualization of self-care is. That we must ensure that there is enough physical care, there is enough self-reflection, there's enough psychological as well as spiritual, natural world connection. And many of these domains may not lend themselves in the same way as today because of the circumstances in which we are. So physical self-care, we have to look after ourselves. We have to ensure that we are taking care of our body, of our nutrition. Sleep patterns have to be good. We are going through a regimen of showering, changing clothes, and all of that, which normalizes life for many of us. Adequate sleep is very important. As I've said, diet is very important. Psychological self-care is an important issue, which is why I guess people like me were asked to come. And here, I think the important thing is to reflect on to use one's inward motivation. So sometimes the external environment will be very challenging, but we have to use that drive that we have to not only continue our routine, but also to incorporate learning new things. We are learning new things about social distancing. We are learning new things about, maintaining a little bit of improved hygiene practices, but also learning new things about the world, about things that we can do despite these restrictions. All of that are important. Practicing mindfulness and creativity, and it may mean different things for different people. It could mean cooking for someone, it could mean meditating for someone, it could mean playing something for someone. So I think we all have to find a spot and things that make sense to us, and then go with that. I think this is also a wonderful time to take 30 minutes, 15 minutes to read something that we've been holding off. Learning, teaching new skills, whether it is to colleagues over WhatsApp or virtually. But at the same time, digital detox is also important. I know that many of us will spend 16, 17 hours on the machine, and that's also unhealthy. So making sure that the calls that we do, the outreach we do are sweet and short, and then we take a few minutes to walk around, do our usual chores, and come back. Journaling in mental health is thought to be very important. It is the idea that we will reflect on our own thoughts and emotions and create like a diary of what kind of churning we are going through as such. Emotional self-care is an extension of psychological self-care, and we know that increased emotional intelligence, and it's not as though I mean, emotional intelligence is something that we all have to strive towards. But those of us who have better or higher emotional intelligence will somehow manage stress and have a greater compassion for not only ourselves but for others. So this is a time to learn to empathize. It's a time to learn to manage our emotions, and increasing our emotional equity, if you will. And one of the things that, an easy thing that people are talking about, and you must have read it in internet and elsewhere, is to have a gratitude list in mind. That let's be grateful for things that some of us are able to do and others are not able to, and that immediately, puts things in perspective for us. Assertiveness is very important at this hour. So, for example, you have to go and do something for your boss, or you have to go and feed your kid. I think prioritizing and sometimes making decisions about what should come first. And I mean, sometimes you may give priority to feeding and looking after a child, but at other times you may want to get back to what your supervisor has asked and the urgency, if the urgency is there. So I think being assertive is important about one's boundaries or what needs to be prioritized. And then it is very easy for healthcare workers to get cut off from one's feelings, because that sort of distracts you from working well. And I think that's where a lot of negative things happen. So it's important to be mindful of what we are feeling, even if time and space doesn't allow us to delve into that. But that once we are mindful of that, then we are very compassionate. We are also mindful of what we can do, what we cannot do, our own boundaries. So I think reflecting on one's feelings is a very higher order behavior in some ways, and it's particularly important at this hour. Social self-care is about ensuring that we are in a supportive network of relationships, and I don't only mean work relationships. I mean relationships that matter, that give you that give you a sense of satisfaction, that empower you, that is part of your cultural network. And essentially these are people we trust and we turn to in need. And these are not necessarily these WhatsApp groups where you're constantly bombarding each other with messages, but these are people and networks that enable us to strengthen ourselves. So I think being very mindful of not bombarding yourself with all sorts of things, and yet connecting with a web of network is the right thing to do at this time. And this will increase a sense of belonging and connectedness. For example, it may be nice to think of at least three groups away from one's job. So, not have always links from the job, which is also important, but I think have some of your old friends or relatives or whoever it is, immediate family members. If you told people something, honor your word or commitment. That is also one way of strengthening social ties. If you feel sad, ask for help. Meet people virtually, meet new people, enlarge your connection, because obviously there is a limitation to how much we cannot meet new people right now physically. And family activities will be virtual activities now, but it is good to talk to your mother. It's important to kind of meet with your father if he's away, or a cousin, and get to know what they're doing, plan something while you're all having a meal, or however it works out. But it's important to be connected. And today technology allows that. Professional self-care is about sharing one's strengths, but also sometimes our challenges with a mentor. And this mentor's job is to help put things in perspective. And I know that KNH, through its research outreach, has been educating healthcare workers around the mentorship model, which is very important. One should also know professional boundaries. So if there are colleagues who are going through challenges, this is a time to be benevolent. This is the time to be mindful of challenges. It is a time not to be intrusive. It is not a time for supervisors to be abrasive. It is not time for workers to be abrasive. It is time for people to show higher levels of empathy. Stress will break us all in one way or the other, and what we have to do is to be empathic and to be connected, and that you do by respecting each other's boundaries. Feed your needs, which means, well, take breaks as you need to. Go for lunch, go for stretching a little bit. But if you feel a little bit tired of the meetings, feel free to step out and go and have a nap for half an hour. So make sure that you are not straining yourself constantly. I mean, there will be days when we have to do that, but we try and make sure there's room to recover. Know your roles and responsibilities. Include, make sure that virtually what kind of assignments have been given to you. Make sure that you know what is the next action plan you're working on. Make sure you know who you're reporting to in all of these emergency procedures that are set in place. Make sure you are mindful of communicating things over email and double checking them. We can, written emails can sound a little bit funny if they have been written in a rush. So make sure that you have a good sense of what colleagues are expecting, and you double check those things. So I think it was written in that kind of a context. And it is very good to participate in sessions and trainings like this, because we are all connected through this network. Now, environmental self-care in the context of COVID, it means many more things than what I've written here, and I'm certainly not an expert. But there is the environmental safety for health workers that we have to follow, which is the use of PPE, which certainly for people who are encountering the COVID patients that have to be suspects, patients have to be taken care of. The use of gloves, gowns, apron, all of those procedures have been well laid out, and I reviewed them, just before this in a set of slides that Dr. Kinuthia had shared. So there is enough clarity from the system point of view as to what we are supposed to do. But I think it's also important that just because some of us are working from home, that we create a mess in our own house around our desk it's not a good idea. So to be organized and maintained, well-maintained desk and working desk is very important. If you don't do that, your kids won't do that who are away from school. So it's important to have some sort of semblance of normalcy, and you do that by creating a organized routine. Do your routine chores regularly. So if you were having breakfast at whatever time in the morning to rush to work, make sure you stick to some of those things. I think routine will give us, all of us, a sense of normalcy, which is very important in this context. Spend time in your balconies, or in your garden, or in your doorway, wherever it is, for a bit of fresh air. There is no harm in not playing with your phone, not playing with your machine, and just keeping quiet and enjoying the fresh air, and not do anything. And there are a number of studies from neuroscience, psychology, that would say that rather than just playing with your phone, just checking the same messages 20 times, it is much better to make a call to someone and talk to them. And it is very good to keep that phone away for 30 minutes, 1 hour, and to just allow our brain to process what we've been going through. That's good. It's good to be by oneself. And then obviously monitor technology use. It has another aspect to itself, that we may be constantly doing it, and unconsciously our children will do the same, or people around us will do the same. So make sure that at this time we are setting a good example. Spiritual self-care is also really paramount, in the sense that the beliefs and values are a key to us, and hence they influence our lives. And the spiritual awareness will help us refine our goals and practices further. And again, spirituality may mean different things to different people, it may mean meditation, it may mean prayer, it may mean other set of rituals, but even journaling your thoughts, volunteering virtually in supporting people and talking to your pastors and people who matter to you spiritually is very important. What I would say is that make sure that you're using credible resources and you're watching your time, because all of these over exciting things on virtual kind of platforms will take our time away. I'm not able to, since the slides are remote controlled. Can I move to the next? I don't know why I'm not able to move my slide. Have I handed over the control to the team here? Are you able to hear me?
You? We can hear
Why
you,
am
Dr. Kumar.
I'm not able to move my
Your slides from your end?
Yes. Can I undo the stop share thing?
Yes, you can do the stop share thing.
Okay.
All right.
Okay, let me start again. Am I making sense, friends here? Do you think colleagues, do you think I'm making, I hope I am, okay. All right, I think I'm able to do it now. So in a nutshell, the merits of self-care is that
sorry.
Okay. All right. So thank you. So the merits of self-care is that it helps, if we do all of this stuff that I have just mentioned, we will prevent ourselves from burnout. And what is burnout? It's a state of emotional, mental, and physical exhaustion. It helps also in relationships. If we are looking after ourselves, we will maintain healthy relationships, we will have a better self-esteem, we will have confidence, and essentially we will be more happier people. And once we are happy, we tend to share that with family, friends, co-workers. So it's a very small practice to incorporate, and it has a long effect. And it will make us more effective. COVID will test us in ways we haven't thought about before. And feeding well, exercising, and kind of using this self-care will make us more resilient. Now, I would like to encourage all of you to develop a self-care plan. Some of us like to write it down. Some of us will think through in our heads, whichever way works for you. But each plan is unique, with no one size fits all, and we have to use our own kind of principles and ideas to make one that will work for us. So the things that we need to think about are, how do we readjust our needs, strengths, and limitations to ensure that it is a plan that can help us address this crisis we are in. So there are 4 steps of building a self-care plan. First of all, we need to evaluate our coping skills. Then we need to identify our self-care needs. We also then need to understand the barriers and areas for improvement, and then kind of develop one which we will follow every day. So let me take you quickly through what these mean. Now, evaluating our coping skills typically means we evaluate our habits. So I may get up in the morning and say, well, I'm going to exercise, but I like to procrastinate and I don't want to do it. But I can challenge it by saying that I have a tendency to say I will do it and I won't do it. Or if you spend all the time before the machine, or all the time doing some work-related thing, that you will spend 1 hour doing something else that matters to you, even if it is tidying your cupboard, talking to your child, spending time with your wife or husband or whoever it is, do that. So challenge your habits, examine and challenge your habits. Then you want to ask a question like, how do you cope with stress due to demands in life? Are you someone who will be unhappy and would be kind of irritable throughout the day just because there's so much of stress, and then you will eat poorly, kind of relate poorly with others? Do you know when you need a break? I mean, do you know the right time when you should take a break? And do you do that? Do you then take a break? So there are positive and negative coping strategies that we use in different challenging moments. And it's important to ask ourselves, which strategies do we use? And if we are using a lot of negative strategies, getting upset with children, having fights with co-workers or our partner or neighbor or whatever it may be, not being able to complete the task, feeling very irritable and tired the whole day, then I think we need to readjust some of those and introduce more positive coping strategies. I can send you a list of some of the strategies that we know are positive and negative. I wanted to make this very quick, but I'll send you some, and I know that there will be many others that you will all know about. Identify your self-care needs. If you really reflect, what is it that you can do which you aren't doing enough that will improve your sense of well-being. And then you say, how do I optimize it? How do I engage in these practices right now? So suppose I need to spend 1 hour doing a particular, for on exercising or doing some work at home or doing some work that is required for work, some assignment for work, whatever it is, go for it then. Are you more active in some areas of self-care than others? I mean, you may be doing a lot of spiritual engagement, but actually you don't really pay enough, attention to sleeping decent hours, and you are constantly tired because of that. So be mindful of, or emotionally you feel you're not giving your children who are at home enough time. So make sure you're attentive to where you're overdoing and where you're underdoing. Remember that wheel of self-care in mind. Then there are barriers sometimes and areas for improvement. And one of the ways of addressing those is reflect what is working, what is not working, and how can I remove what is not working, because that really is a stumbling block. Examine, check the barriers. Is it I cannot exercise because somebody has to look after the child at that time, or I have to do something else, I have a phone call to attend, and see whether you can get up earlier, or can you do the exercise immediately afterwards, or can you adjust that phone meeting that you have, and create new strategies. So we have to also do away with this mindset that problems won't go away. Sometimes we become very comfortable with problems, in psychology we call it learned helplessness. That we are so used to becoming helpless that we adjust to this. We become very attuned to it rather than challenging it. So this is a time to challenge that helplessness. Replace it with coping strategies that may be a little bit neutral. Even if, suppose I want to exercise 1 hour and I barely manage, to bring in 15 minutes. It's all right, and slowly increase it to longer. So replace bits by bits, but ensure that you are targeting the most harmful practices first, coping mechanisms first. So if your immediate response to the stress you're in from the workplace is to fight with your spouse, then I think ensure that you do not escalate those kind of arguments. You hold back a few things to become a bit more tolerant, work on yourself. And now create a plan that would work for you. So I think in a nutshell, that is what I wanted to convey. I know that there is some room for us to reflect, meditate on when did you last do something you enjoy while we are at home in this abnormal circumstance. Did you spend a little bit of time with your family? Did you spend time listening to your child do some activity? Or your spouse do something? Did you have a warm conversation with your coworker, not necessarily about the work, but how they're doing, or something else? Did you read a nice paper and enjoy it? When did you do something you enjoy with family, friends, colleagues? Now here, I'm not talking about expanding our circle. I'm talking about the same sort of small nested circle that we are all meant to be in our family, and making sure that all 4 or 5 of us who are in the room are not playing with our phones, that our physical presence, we are optimizing it the best. We ask our children, we ask our, if they're elderly parents or somebody else, how they're doing, and we engage in a conversation. Hopefully the conversation is 24/7, not about Corona, but also about something else. When was the last time you achieved a goal, a personal or a professional? Those of us who have incomplete papers, are we thinking of spending half an hour finishing that, or something else? It's something for our coursework or for our professional life. If there was a personal goal, are we working towards that? It's very important to balance both. And action point, what do you plan to do about these things? If you've not done enough on these aspects, can you now maybe incorporate this kind of meditative, reflective exercise, but turn it into an action if you can. And then if you felt a need, we could go through some of these relaxation techniques. You could do it with your family, with your co-workers. And I mean, it needs time, but what I would encourage you to do is to close your eyes and try and just observe your breathing. Don't change anything about your breathing, but for a minute or two, observe your breathing. Then slowly try and lengthen your breathing. And those of us who work in mental health know that just watching ourselves take our own time in breathing slowly and comfortably, we can take away so much of stress and so much of internal turmoil. So I think breathing mindfully and deeply is a very spiritual, high order thing that we somehow take for granted and forget. So start with that, and I would be very happy to take you through other strategies if you felt a need. I'm sure you're all very competent people. And then for later, if you felt, we could talk about stress and coping, psychological first aid training that WHO, I know Kenya Red Cross talks about it, and I've done a lot of work. Healthy habits for virtual work, what is healthy, what is not healthy. And now that all of us are going to be at home, or most of us will be at home, we don't want to bicker and create challenging environment. We will have our kids there, whether they're adolescents or they're little or they're older, or whether we have parents. We want to strengthen relationships. So I think with that, I want to conclude this talk. I hope there was something that you found helpful. And thank you very much again. I can take up any questions if anybody has.
Thank you. Thank you, Dr. Manasi Kumar, for the presentation. It was simple and to the point. But before we take any questions, is it possible to get some comment from Getawa Silwa, from Sheila Kimani? I also see we have Purity McKenna from Red Cross. Purity, how are you? So could we get some comments from those people, and also Dr. Ian Kenyanya, who's the head of mental health department? Yes, Geta, you're next.
Oh, sorry. Thank you so much. I hope you can hear me well. I want to thank Dr. Kumar. She has presented quite a lot, and the information she has given us is quite useful. I would just like to add on something small. I want all of us to understand that all staffs dealing with the persons with COVID-19 are likely to develop stress. They are likely to be stressed, and as they get stressed, others are likely to feel like, because I'm stressed, maybe I'm not performing well, or I'm not doing so well, or I'm getting too much work, I'm getting so overworked, so I'm not performing to my best. I would like everyone to know that getting stressed at such a times when you are dealing with such conditions that are new and people are not really sure of what is happening, getting stressed is normal, but you need to understand, how do I deal with this stress? How do I cope with this stress, as we have been taught, so that you are able to manage your stress and you are still able to remain sober and to continue performing. So you need to ask yourself, how do I manage my stress? Different people manage their stress differently. We have those who have learned different ways of coping, which they feel this is a better way for me to cope with stress, and you find another one has a different way of coping that is good for her. So it's good for us to take the best method of coping with the best method that is good for you to cope with the stress, and avoid the negative ways of coping with stress. The negative ways of coping with stress are like taking alcohol. Some take alcohol to forget about what they have gone through, and they end up becoming alcoholic, and also turning to abusing other substances, which can end up destroying your life. So it's important to avoid that. But as we have been taught, the best way of coping with stress is using exercises, as we have been taught, exercising yourself. And exercising yourself, there are different ways of exercising yourself. You can exercise by running, taking a walk, and as you take a walk, you take a brisk walk. You walk fast, you don't walk very slowly, because if you walk slowly, it won't be of use to you. And apart from walking and running, you can also exercise, you can also relax your body by listening to some cool music. When you listen to cool music, the one that is not noisy and irritating, it helps you to turn your focus from from what is stressing you, and then you are able to enjoy the music, to listen to the words of music, and then you are able to find yourself again and to feel at peace. So try to use that, but also as what we have been told, you have to make sure that you eat a balanced diet. You don't just eat anything. When you eat a balanced diet, it gives you enough nutrients that will enable you to be strong enough to be able to continue working. And it's also important for you to continue keeping yourself socially healthy by talking to your friends, talking to your relatives. And now that we are keeping the distance, please keep chatting, keep using your phone so that you are not left in isolation. Because when you are so stressed and you remain in isolation, that is when you can easily become depressed. So for you to avoid being depressed, please socialize. Socialize with those people who matter to you, those people who add value to you. Another thing I would like to add on that also is that if you have to avoid this stress, we have to make sure that when we are preparing for the management of this COVID-19, it's important that the managers involve the staffs who are going to work in that place. It's good to involve them in the planning and also in the training, so that they are trained enough, they have enough information on all the things they are going to use, like how to use the PP, how to use the masks, how to use everything that they're going to use. They need to have enough knowledge so that they don't end up getting stressed because they feel uncomfortable in the outfit, they feel uncomfortable with everything. But if they have enough training, they're able to feel comfortable with it when they are using it. And also when they're involved in the planning, they are able to feel part of it, and they are also able to contribute where they feel it's necessary for them, so that when it comes to working, at least they will have planned enough. They will have put in their contributions in the planning. They would have asked for everything that they need, so that the time they are working, they don't have a lot of shortages because they were not involved in their planning and everything was left out. So now they have to run with the shortages, and which is not so good for them. Yeah, and as we come to, when they are coming to the end of managing the COVID-19 persons, it's also important to remember that they are also supposed to be taken care of. Our staffs should be taken care of. We have to continue giving them personal therapy because it's very important. We don't assume that after they have finished taking care of the persons with COVID-19, now they can just disappear into their homes. They need to continue with personal therapy, and they also need to continue with peer counseling. Is it? Oh my God. Okay, hello. I hope you are getting me. Okay, hello. Yes, I'm saying when we come to the end of managing the persons with the COVID-19, we should not forget the staffs who have been taking care of these persons with COVID-19, because they need to continue with their personal therapy, which I hope somebody will take care of. And they also need to continue with their peer counseling so that they get they can get counseling from one another to encourage one another. And they also need to have group counseling so that they are able to support one another in groups. And this will help them to be able to come out of it and be able to integrate with the community very well. Thank you. I think I can hand over to my colleague, Shaila, to be able to deal with the stigma, which is normally found, which most staffs go through, the persons with COVID-19 also go through, the relatives, and it's something that is not so good. It makes it so difficult for us to manage the persons with COVID-19. Thank you.
Good afternoon, everybody. Thank you for coming. I'm going to take exactly 5 minutes because you're running out of time. Very happy that everybody could join us. Stigma is huge. It's a broad subject, and cannot. But we will try, and I will just recap. I'll just give the very basics concerning stigma, because it has been reported by healthcare workers across the board. And the thing we need to remember about stigma is this: is that stigma is prejudice that is based on ignorance. Why? Because COVID-19 is unknown. We don't know much about this particular disease and the infection, and we are still learning. So stigma is one of those things that we will definitely come across as frontline workers, even as we continue to care for those who are infected or affected by COVID-19. Now, facts rather than fear will stop the spread of COVID-19. And as health workers, we should be on the front line of sharing facts and accurate information about this disease. We should challenge the myths and the stereotypes. And of course, we should choose our words carefully, because the way we communicate can affect the attitudes of others. Those 3 things: share facts and accurate information about the disease, challenge myths and stereotypes, choose words carefully, because the way we communicate can affect the attitudes of others. See you next Wednesday.
Okay, thank you so much for that presentation. Sheila, Geta, and Dr. Kumar. Dr. Kenyanya is online. Dr. Kenyanya, would you like to give us a comment or two?
Yes, good afternoon, everyone.
Good afternoon.
I just want to take this opportunity to thank the 3 presenters who have very ably made their presentations. I specifically want to take note of Dr. Manasi Kumar's presentation and her plan. She has actually captured what we, even at the department, have planned to do. The first session that this session is supposed to be, and I believe that now we are going into an interactive session. It is supposed to be on how to cope with stress as healthcare providers. So I have seen Dr. Kumar has that in her plans. I have seen she has psychological first aid training in her plans. That one is planned for this Friday. So I think we are working in sync with the University of Nairobi, as much as we have actually not discussed this. So I just want to thank the presenters, and I'm happy that the participation also is very good. And I think that we will just invite the participants now to comment and to ask any questions that they may have. Thank you very much.
Thank you, Dr. Kenyanya, for that. Purity from Red Cross. Oh, is she there? Oh, she's left. Okay, she's left. So I'm seeing a few questions.
Dr. Kalondu?
Yes.
Purity had some challenges on her end.
Okay.
She tried to log in with us, but at some point she had difficulties. I think she might have given up, but she's with us.
Okay. And we appreciate that. Thank you. So let me quickly go through the questions that have come in. One was from John Kagame. Joan Kagema is one of our staff, and she's asking, is there any psychological and emotional support for the people being quarantined who are in charge for the service? Are there any plans concerning the same? Sheila or Geta? Anyone of you
Please repeat.
John is asking, is there any psychological and emotional support for the people being quarantined who are in charge for the service? Are there any plans concerning the same?
Yes, absolutely. We have plans are underway to provide support for the patients that are quarantined, and those who are in quarantine, and even the patients of COVID-19. And shortly, perhaps within the week, we will be having confirmative information on how that will be scheduled, and we will definitely let you know how it goes. Meanwhile, you can reach out to us on our phone numbers, and we will be happy to provide any support that you feel would be necessary.
I'm seeing John's hand. John, let me unmute you so that you can maybe clarify your question.
Yes.
Hello, John.
Yeah. Good afternoon, everyone.
Good afternoon.
Yeah, I'm so much concerned because I'm as a person, I'm in quarantine, and I've not seen any psychological or emotional support for those that are coming to see us. And it takes a lot of our emotions. It takes about having many things that we think about, because there is no communication that is telling us what is happening, what is the next thing. So that's why I'm asking, how much, who is supposed, or who are the in charges of the psychological and the emotional to support even the people that are in quarantine? For me, for now, I'm in quarantine, and it makes us even to start having high blood pressures. I hear there are many who are getting pressures just because there's no support, because the communication is also not there. So those are the things that I'm really concerned about, because it's not about here where I am and other centers, because I think the same thing is also happening, because you cannot say about tomorrow or next week when you are still in the process on the ground.
Okay, thank you, John, for your concern. John is one of our NH staff who came into the country and had to go through the government directive of quarantine in one of the facilities provided by the government. John, what day are you in right now?
Respond to her.
I'm day 7.
Day 7.
Day
Hang in there, it's almost over. All right.
And I'm still hanging there.
Hello?
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 Hello? Hello?
Yes, can you hear me, John?
I can hear you. Yeah.
I feel you.
Yeah.
And as you have heard, plans are underway for us to be able to reach you people. But meanwhile, before somebody is sent to where you are, you can call and talk to us, and we can give you our numbers even online now. You can just call and we'll be able to talk. I'll be able to listen to you. Are you able to take the number now?
I can take with a pen.
Okay, 0722.
Just give me 1 minute, 1 minute. Just say it.
0722 88 29.
Just hold on, repeat again.
0722
yes.
88 29 29. Yes, 29. Yes, 32.
32. Repeat again. 0722
yes.
88 29.
Yeah, it has been sent. Then, yeah, the number has been sent. Yeah.
Okay, fine.
Thank you. Okay, so when you call, I'll be able to talk to you. Thank you.
Good, thank you for that. John Majimbo, your hand has been raised for quite a bit. Let me unmute you so that you can.
Okay.
Hello, John.
I'm okay.
Oh, you okay?
Yes, I'm okay. No, I'm okay.
All right.
I'm okay. My question has been answered.
Okay, thank you. Kaylee? Hello? Hello, Kaylee? Yes.
It's fine. I've understood. Thank you.
Okay, thank you. All right. All right. Let's go to the next question. The next question was from Dorothy Awak. Dr. Dorothy Awak is asking, is there specific debriefing sessions for staff working directly with the patients diagnosed or undergoing testing for COVID? Sheila, are you able to take us through that?
Yes. Again, we are developing a protocol, and we are available for
una overload.
I'm back. Can you hear me now?
Yes.
Okay. So what I'm saying is that we definitely, the counselors are available to attend and to give any support that might otherwise, and phone numbers will be and have been provided, and until we can organize a way that we can meet face to face and have a more interactive session, please make use of the phone numbers that have been given to you, so that we can continue to talk even before we meet.
Thank you for that. Dr. Kenyan, I see your hand is raised. Is that Dr.? Hello?
Yes, thank you. Thank you very much. About the debriefing, actually we have started. From Friday last week, we have been doing debriefing for staff who are working with the COVID-19 patients and suspected patients. It's only that we are starting, we are just starting, so we have not reached many people. But the plans are on to reach as many people as possible, because we recognize that this is something that is very much needed, and we are working on it, please. So we have started. Just this week, we had, on Monday, we had a debriefing session in Kenyatta, but we'll have more and more. So, and then for those who are in quarantine, we are working with some, but some of them, they are not actually falling under us. I don't know where Joan is, because there are those who are under Madare Hospital and the ministry. They are the ones who are, like, they are the ones who are reaching out to provide service for them. So yes. I don't know where Joan is.
All right.
Yep.
Okay. John, I'm sure you'll be able to get help. If you call Geta's number, she'll be able to assist you. For everyone who's asking about the slides and the recording for the presentation, you'll find it at the KNH website page. It will be loaded up tomorrow. There is a folder on coronavirus. There's a coronavirus folder. Click on the sensitization folder once you open up the coronavirus folder. So you'll be able to find all the slides there and all the information. There's another concern from Dr. Mureithi from the Ministry of Health. Dr. Mureithi is saying, thank you for the information, very helpful. The dentists are worried about two main issues. One, the lack of PPE when they have to attend to the patients, even in the hospital setup. And two, lack of income for those who rely on their dental practices that are now closed. Is there any available financial support for sustaining businesses during this period? Dr. Mureithi, thank you for listening in. Unfortunately, we are not in a position to answer about financial support, but if you do need psychological support or any mental health form of support, psychosocial support, this team is ready to address your concerns and listen to that. But for financial support, unfortunately, we are not in a position to answer that. About lack of PPE, kindly let us know where you work, which area that you're working in, which hospital, that we will be able to forward your feedback to the relevant authorities. Okay, yes. Kagema was also asking again, good presentation, especially for us being quarantined, that we should avoid stress. All right, that was good. There's a question from, no, these were just comments. Any other, let me see if there are any other questions down in the comment section. We have a concern from, let me see, let me go through this very fast. Most of these are email addresses and contacts. Yes, from Michelle Stephen. Michelle Stephen is one of us. He's a staff at Kenyatta National Hospital, and they're saying, thank you, Dr. Kumar, for the wonderful presentation. Number one, I am just wondering if this is the right time for the hospital to carry out Gemba Kaizen audit. And two, during the COVID-19 sensitization for OBSGYN, I could identify stress that is related to lack of enough PPE. Thank you, Dr. Kumar, for highlighting these issues. All right, Stephen Michelle, we will follow up with your concern about the audits. We'll be able to give you feedback from the quality assurance manager. Thank you for that. We have a question from Judy Wanjiru Mashuka, and she's saying, thank you, Dr. Manasi, for the informative presentation. Is there a plan for checking in and debriefing regularly for healthcare workers in respective departments to facilitate mindfulness as a way of self-care at work? Judy, I believe your concern has been addressed by Geta, Sheila, and Dr. Kenyanya, especially if you're working in KNH. There are plans for regular debriefing for sessions. From Dr. Osano, I think just letting those in quarantine know what is happening in regards follow-up would be helpful. I don't think the information is reaching them. Instead of waiting for them to reach you, inform the Ministry of Health staff to give you their numbers to reach them proactively. Not all of them may be in a position to know your availability. That is true. Thank you for that feedback, Dr. Osano. We were really hoping to have Purity McKenna from Red Cross because they're part of the team that is supporting the psychosocial support for Kenyans who are in the quarantine facilities and also non-Kenyans who are in the quarantine facilities. So we were really hoping to get some comments from the team that is on the ground doing that. But unfortunately, she was not able to log into our call today. Okay, let me see, is there anything? Nairobi Metropolitan Services, this is from Kibe. Quarantine teams have counselors dedicated for psychosocial support. So maybe it's just for us to be able to find how Joanne can be able to contact the person or find if we have the schedule and be able to disseminate it to the people who are in the quarantine facilities. But you can see that there's a team that is dedicated for psychosocial support. Judy Joyce Dandy is saying, Kenyatta University is one of the facilities for quarantine. Are there personnel from Ministry of Health deployed to take care of them? Joyce, I am not sure if there are any personnel from the Ministry of Health that are deployed to take care of the people who are there. But I'm sure in the timetable for the Nairobi Metropolitan Services, there must be a team that is fully dedicated. There are medical officer or a medical or a clinical officer, nurse, some form, a person who's offering psychosocial support, maybe a physiotherapist. I am sure there's a team that is on the ground, but we don't have the timetable with us right now to be able to know who from the ministry is working there. There's a raised hand from Michelle. Michelle, let me unmute you. Hello. Hello, Michelle. Okay. Hello. Sorry, that seems not to be going through. Let me unmute Michelle. All right, I can't seem to unmute Steve Michelle, although I can see his raised hand.
Hello, can you hear me now?
Yes, we can hear you now. Thank you.
Oh, thank you. I'm just saying that I can identify the Joanne with what is happening.
Okay.
Yesterday, I shared with a friend of mine who's in a quarantine.
Yes.
And I'm telling you, it was difficult. I'm thinking it's important for psychosocial care to take over this management.
Yes.
Because number one, this lady was telling me when it was going to be tested in Bagadi, it was very hard for her. Nobody was telling her what was happening. She was just shown the ambulance to get in from a certain location to Bagadi and then back to the place, and nothing has been communicated to her. I am thinking the psychosocial care is very, very key in this, kindly.
Yes.
Thank you.
All right, thank you. We hear your concerns. I hope we'll be able to send them over to Purity from Red Cross, who are really handling the psychosocial support. Teresia Kenyari is asking, is there online debriefing for health workers? Last week, what mental health department had was physical debriefing, but Sheila, maybe you can let us know if there are any plans to have an online.
Okay, so just to answer her question, I think it is doable, and I know we had tried it sometime last week, or it was last week, yes. It was not very successful because people had challenge on logging onto the Zoom group chat, but it is doable. And if there is a need, if a need arises for us to do the online chats, then absolutely we will be very happy to do them. And again, I will reiterate and say, please call us and let us have a discussion, even over the phone, not necessarily online, and let us hear what it is that you have to say.
Okay, thank you for that. Dr. Kenyanya, is there anything else you'd like to add?
Yes, I was just saying that for the benefit of everyone, we have partnered with the Kenya Red Cross in this. They are supporting us. We are working with them in the provision of psychological care. And actually, they already have toll-free lines, which I'm going to share. I'm going to contact them to share with us. But also, we in Kenyatta, we are in the process of acquiring toll-free lines to facilitate online counseling. So there are plans in the pipeline. Thank you.
All right, thank you so much for that feedback. From Fenwick Mudanja. Hello, Fenwick. Good. For the 2 Kenyans who are fully recovered, is there a need for them to keep social distance? Fenwick, from the studies that have been done or from data from China, there's still risk of reinfection. We don't know about the Italy case, whether there's risk of reinfection once you're declared negative. So I think it is still best that they maintain the precautions, but we will hear more from Dr. Loisa Cheng, who will be with us on Monday at the same time, and she'll be able to give us more information on whether they still need to observe the precautions or now they have developed immunity to be able to fight this, to be able to not get reinfected again. For Makera is saying, hi, Dr. Makera, there's a lot of planning for health workers. I am wondering if we're including support staff in our various organizations. Better? Are we having support staff?
Okay, hello. Yes, as we are planning sensitization of the health workers, we are remembering the subordinate staffs, and in KNH and Bagati, we have been including them. We have been sensitizing all the groups that are working there, all the staffs, starting from the doctors, nurses, subordinate staffs, every person that is working there. So we are remembering them.
Thank you for that. So yes, Makara, we are also having sensitization for our support staff. It's our whole team. Healthcare is a team, it's teamwork. So the whole team is involved in that. Sorry, let me clarify that Dr. Loisa Cheng will be with us on Friday at 10 a.m., not Monday, like I said before. So Fenwick Mudanja, we can ask her more about the patients who've recovered and how they're doing at that time. Thank you for that. There's from Sheila. Sheila is from Nairobi Metropolis Health Workers. They can reach the psychosocial team on this number. I hope you can all see the number on your screen for support. Teresia and Jerry, let me unmute you so that you can ask your questions or give your feedback. Hello.
Thank you very much.
Yes.
Hello, thank you very much for having me.
Yes.
I want to ask, I'm calling from Kwale County.
Yes,
The toll-free numbers, are they only for K and H, or we can have them in counties also? We can also access toll-free numbers for each county. Then number two, do we have protocols at the national level for psychosocial support for both health workers who are not working in the COVID isolation facilities and those who are already working in the isolation facilities, plus those on quarantine? Do we have different protocols for them?
All right. Dr. Kenyanya? Hello? Hello, Dr. Kenyanya?
Sorry, I don't have any comment now.
All right, but Teresa is asking if there are toll-free numbers for staff outside in the counties. I can see there's one for Nairobi County. I'm not sure if it's a toll-free number, Teresa, but there's one for Nairobi County healthcare workers, which Sheila has posted up. The one that Dr. Kenyanya was talking about was for KNH staff, but I'm not very sure. Maybe you can comment more whether there's one that the ministry is planning to roll out.
I am not in the know now. Please let me find out. Let me find out, please.
All right.
Yeah,
So Teresa,
a suggestion would just be, as you're sourcing, maybe nationally, we can do the same for the counties to ease in the process.
Okay. Thank you for that feedback. We'll be able to pass it on to the relevant authorities.
Thank you.
John Kebaso.
Yes.
Hello. Yes.
How are you?
Very fine.
Very happy for your presentation.
Yes.
But my question is based on those people on quarantine.
Yes.
Now that you've arranged on a psychosocial events, how are you planning? Are you going to do it online, or you are planning that the psychosocial people to go and do it in their quarantine places?
All right, Sheila, we'll take this for you.
Okay, we are planning to do debrief sessions face to face, and so through our team leader, we will roll out the schedules so that we are able to meet with all departments, all health workers who feel that this is something that they want for their teams, and it will be made available to everyone.
Hello. Yes, I wanted to make a comment on psychosocial support for all the counties. The Ministry of Health is making arrangements to organize for psychosocial support in all counties. So it's underway, and very soon they'll be able to implement.
Thank you, Sheila and Geta, for that input. There's a comment from Evelyn, who is also reiterating what had been said earlier, that there is a team of mental health, the counselors, especially counselors and social workers, who are attached to every quarantine station. And Teresia Kanyari is asking, do we have a hotline that someone can call for debriefing? Teresia, yes. In KNH, there is a mental health department. If you call the extension number, you'll be able to get that. There's a Red Cross hotline number. I will just post that for you right now, or I'll be able to give you feedback right now once I confirm the toll-free number for Red Cross. Also, Mokere is asking for the Red Cross number. We'll be able to share that with you in a minute. Michael is asking, are there mechanisms to deal with healthcare workers' fears to help them prepare for emerging cases, especially in light of possible increase of cases? Consider also lab personnel who deal with TB sputum samples, even as they work towards enough PPEs. Geta, is there any feedback on that?
Hello. Yes, we are planning to reach out to all the staffs, that's including the laboratory staffs, to be able to debrief them on all their fears. I remember last week when we had the debriefing session at Mbagathi, we had several people from the labs and they were able to raise their issues. So we are going to continue doing that so that we are able to allay all the anxieties of all the staffs.
Thank you for that. Yes, so Michael, there are mechanisms to be able to assist the other healthcare workers. I know the fear is quite a lot, and especially after yesterday's news where we heard that there's a healthcare worker who could potentially have been infected with COVID while attending to our patients. So the fear is real, and it's now time that we address this issue. So thank you so much, Mental Health Department, for stepping in and filling in that gap. There's a comment from Dr. Osano, and he's saying we should actually start saying physical distance and not social distance. Social distance can mean we don't interact with them and increase stigma. We can be socially be close by social media and other non-physical ways. That is very true. That's very true. So you should embrace the term physical distance, not social distance. There's a comment from Dr. Amina Nyangeso Rajab. There are those who being stigmatized for handling such cases. How can you help the healthcare worker not stigmatize fellow colleagues?
We had discussed earlier on this same forum strategies that would help us to overcome stigma and also to rid our society of the COVID-19, of the stigma that is related to COVID-19. And we said number one is to provide the correct information, separate the facts from the myths, and of course, mind our language. Let us mind our language. The way we communicate issues around COVID-19 will help us as much as possible to eradicate stigma towards COVID-19 and the issues around the disease.
So Teresia, let me unmute you again. Hello.
Hello. Hello.
Teresia and Jerry, let me unmute you again.
Thank you. I have another input. I don't know if it's a comment or an input. There's a group of people who may be in need of psychosocial support that we have not mentioned. And I'm wondering whether we have anything for them. These are the families of healthcare workers who are in isolation or in quarantine.
Okay, sure.
Hello?
Yes.
Yeah, as we said, plans are underway to be able to have psychosocial support team offering the services direct to the persons with COVID-19. And as we do that, we'll also be offering services to our staffs there and also to their relatives. So we are considering that.
Okay. Thank you.
I hope the answer was satisfactory, Teresia. Thank you for your question. There's a raised hand from Ian, but Ian, I'm not able to unmute you. But maybe Dr. Kenyanya can, if you're in a position to give us
I'm the one.
Oh, sorry. Sorry. Dr. Kenyanya, so please make your comments and please help us with the Red Cross contacts if possible.
It is K, not K.
Yes.
Now, I just want to give the number from the Red Cross. The number is 1199. 1199. Namna hiyo. The service is available 24/7, and it is reachable from any corner of Kenya. Thank you very much.
Thank you for that. So the number is 1199. That's a Red Cross number and is reachable from any corner of Kenya. So the last one comment before we end this session. Let's see, there's Michael, there's Moses, there's Jimmy. Let me start with Moses. Moses was asking, are community health officers and assistants fully involved in the ongoing exercise? Moses, I'm not in a position to be able to answer that, but we'll be able to find out more details. Maybe when you log in next time again for the mental health session on Wednesday, we'll be able to give you feedback on that. And for Jimmy, is there a plan in place to screen passengers across inter-county borders? And if yes, what steps should be followed, suppose they find a suspected case? Now, Jimmy, on Friday, we'll have a session on testing for COVID-19, pathogenesis and testing by Professor Anzala. I would like to kindly request you to reserve your question for that day. Friday, 2 to 3 p.m., we'll have a session on pathogenesis and testing for COVID-19. It's part of the national team that is dealing with testing and the plans that are in place. Michael, psychosocial support for families of health care workers on the forefront of this as a follow-up to what Teresia was saying is equally important. Thank you for that feedback, Michael. I'd like to thank all of you for logging in today. Thank you, Dr. Kumar. Thank you, Dr. Kenyanya. Thank you, Geta Wasilwa. Thank you, Sheila Kimani. And thank you to everyone who joined in and was able to make this session lively. As I've said before, you'll find the slides on the KNH website page. There's a coronavirus folder. Go to the sensitization folder and you'll find all the slides for last week, for this week. And we'll continue uploading more slides as the sessions continue. So thank you for listening in. Have a beautiful evening.
Thank you, Dr. Ari.
All right.
Thank you.
Bye
bye, everyone.
Thank you so much, everyone. This is actually therapeutic. It was good to know that psychologists taking care of everyone, and it is much appreciated.